Morning, everyone. Welcome. Thanks for joining us this morning. My name is Aaron Reinert. I'm the president of the American Ambulance Association, and I deeply appreciate everyone setting time aside in your schedules to spend a little bit of time this morning with a key supporter of our industry, Senator Cassidy. The senator has not yet joined us, and so as we pause for just a moment or two before we begin our event, I wanted to also, on behalf of our association, our board of directors, our staff, all of the volunteer leaders of the American Ambulance Association, happy EMS week. It's a little tough to say happy knowing that COVID-19 has definitely changed how all of us are celebrating this week personally and professionally. But it is a chance for all of us to make sure, and especially on behalf of our association, to make sure you know that your work, your efforts are not forgotten. There are so many important roles in emergency medical services. We often and understandably think of our clinical roles, our paramedics, our EMTs, all of the folks involved in providing patient care. And clearly that work is important and critical, especially in light of COVID-19. But I also want to make sure that our association and all of its members also recognize all of the other roles that are so critical to emergency medical services. Our front office folks, accounts payable, accounts receivable, administrative support, human resources, information technology, finance, accounting, controllers, all of those folks that bring in and manage the financial resources that we need to provide emergency medical services to our nation. Want to thank and recognize the folks that keep the organization running, all of our operational folks, supply, vehicle maintenance, our vehicle service technicians, our educators, our dispatchers, our leaders in the operational world. Again, just want to make sure that as we think about emergency medical services, in this week, our time to pause and recognize the incredible role in our nation's EMS system, not only during COVID-19, but every single day. So would like to begin this morning. The senator has been able to join us, so welcome. On behalf of our association, its staff, and all of our volunteer leaders, I want to again thank all of you for participating in today's virtual town hall meeting with Senator Bill Cassidy. Our country and the entire world is experiencing an unprecedented public health emergency. The very survival of our nation's ambulance services are in jeopardy. As healthcare providers and first responders, American Ambulance Association members are once again on the front line of helping and serving our communities in ways that we never even imagined, such as regularly treating in-place patients as part of our national, our international response to COVID-19. I want to again thank each and every one of you in your operations for your response to the pandemic, as well as providing and continuing to provide vital and critical 911 emergency and non-emergency medical services, both for COVID-19 as well as for all of the calls we receive every day. American Ambulance Association members respond to over 70% of the nation's emergency responses that occur every single day, every single year. All of you are providing these critical, life-threatening, life-saving services to our nation. And you're all struggling with ever-increasing costs and ever-decreasing reimbursement. Our nation's ambulance services would simply not be able to survive if it wasn't for our strong relationship and our strong partners, such as Senator Bill Cassidy. He's been a champion for ground ambulance services during the public health emergency, as well as long before COVID-19. I'm so appreciative that the senator has found time in his incredibly busy day to spend time with us. A quick housekeeping note for all that are participating in today's webinar. Thank you for everyone who took time to submit questions at info@ambulance.org. Asbel Montees from Acadian Ambulance Service will be our moderator today. And so as that time in our agenda comes, look to Asbel to lead the question and answer section. As we begin our time with the Senator, I will be turning the floor over shortly to Richard Zuschlag, Chairman and CEO of Acadian Ambulance Service of Lafayette, Louisiana. He will be introducing our guest today, which is Senator Cassidy. Richard is a longtime member of the American Ambulance Association, and he, his organization, and its many leaders have been one of our staunchest supporters and advocates of our nation's EMS industry and of the American Ambulance Association. Richard, on behalf of myself and the AAA, thank you. Thank you for facilitating today, and I will turn the floor over to you.
Good morning, and thank you very much, Aaron. I have both the pleasure and the privilege of introducing you to my friend and distinguished senior senator from the great state of Louisiana, Bill Cassidy. Senator Cassidy has dedicated his life to caring for people as a physician, a public servant, a husband, and father. He is respected and recognized as a man who puts people over politics and worked endlessly on bipartisan legislation to protect those that he serves. He has been and continues to be not only a champion for our industry, always answering our call for guidance and assistance, but also establishing himself early on as the healthcare go-to guy for his colleagues across the nation and the presidents that he has served and continues to serve. Bill grew up in Baton Rouge, Louisiana, and attended LSU for his undergraduate and medical school education. During this time, he co-founded the Greater Baton Rouge Community Clinic, a clinic providing free dental and health care to the working uninsured. Bill also created a private-public partnership to vaccinate 36,000 Greater Baton Rouge area children against hepatitis B at no cost to the schools or parents. In the wake of Hurricane Katrina, Bill led a group of healthcare volunteers to convert an abandoned Kmart building into an emergency healthcare facility, providing basic healthcare to hurricane evacuees. In 2006, Bill was elected to the Louisiana State Senate. In 2008, he was elected to the United States House of Representatives to represent the Louisiana 6th Congressional District. In 2014, he was elected to the U.S. Senate. He serves on the Finance Committee, the Health, Education, Labor, and Pensions Committee, the Energy and Natural Resources Committee, and the Veteran Affairs Committee. He's married to Dr. Laura Cassidy, and they have 3 children. Laura is a retired general surgeon and specializing in breast cancer. She helped found a public charter school to teach children with dyslexia. He is a man of both faith and science, and I'm proud to call him my friend. Thank you, Senator, for joining my colleagues from the American Ambulance Association and all that you do for the state of Louisiana and the United States of America. The floor is yours, Senator.
Hey, thank you, Richard. Thank you for having me. Richard has been a great friend. He and Asbel and others have educated me to the nuances of your industry, which have evolved. I smile, I'm old enough to remember that in my state, funeral homes used to provide ambulance services, which I always thought was kind of a conflict of interest. and now we've evolved to the point where we're speaking about ambulances being true first-line responders, where they would go out and care for somebody in their home, do all the care that they would need at that point, not having to bring them into the hospital, which would really be a paradigm shift. There's going to be some things that come out of this crisis along those lines that I think will stay with us because they just make sense. And I know they make sense because Richard and others have educated me. So that said, I'm appreciative of everything you're doing and of the unique role you play within the healthcare ecosystem. First, a little bit of an overview, just to know, I know that you know this, but to provide context. Obviously, Congress is trying to provide support for both private employers, for healthcare employers in particular, And I'm also advocating for greater support for cities and states as well. And I'll more about that later. In the CARES Act, we provided stimulus checks for the family, the payroll protection plan, which is kind of evolving as we speak to try and make it even more useful for industry, and the so-called facilities that are being set up through Treasury for those employers that have more than 500 employees or otherwise not qualified for PPP. Now, more needs to be done. Ms. Pelosi and the House of Representatives has put forward a $3 trillion package. And they add more money to the Public Health and Social Security Emergency Fund, but there's actually a lot of money yet to be spent. And I say that because I do think that the bill they put forward will not go anywhere in the Senate. And not that it doesn't have some good ideas, but it has a lot of bad ideas. And so when you mention marijuana more than you mention jobs in a $3 trillion bill dedicated to preserving jobs, you undermine your credibility for the whole product. So the question is, how do we kind of take the few good ideas they have and put it into something which can pass the Senate and can further support? Now, we first have to recognize we need to do some assessment of that which has already been done. Clearly, the distribution of dollars in the CARES Act has not been perfect, but they had to balance, the administration balance getting the money out quickly with getting it out with oversight adequate to make sure it wasn't abused. Congress is contributing to this. And I think most of my colleagues at this point want to just see how the money is being spent, how much remains to be spent, whether or not the mechanism by which it's going out has been improved, and then decide what else to put up. Now, this is where I think your job is. I think you need to create, if you will, on behalf of your industry, an understanding of the unique circumstances of ambulance companies, driven by data, so that as we go into this next phase, there's a full appreciation of both your unique role, the economic challenges that you have, and the measure to which you have or have not had those challenges addressed. My commitment to you is that my staff and I will work with you to kind of make that case known. Now, again, just for awareness, I'm not sure this applies to you, but I will say in case it does, there's been some modification of how the PPP is going to be done. As most folks know, the money had to be spent within 8 weeks on payroll in order for that amount of money to be forgiven. It didn't work for some industries. I'm thinking it probably didn't work as well for you. But let me take restaurants because that's an easier example. Restaurants were told that they had to spend 75% of their money on payroll, but they, in the meantime, had to stay shut down. So they didn't have any payroll to pay because they were told to shut down. When they would begin to open up is when they would need the money for payroll, but by that time they had passed the window by which that money could be considered a grant as opposed to a loan. I'm thinking that if you have some ambulance services which have substantially shut down because the community shut down, then your payroll may have shrunk, and any support you got for payroll would really come in the window after that 8 weeks. So this may apply to you. Treasury and Congress are looking to address this to allow that 8 weeks to extend up to 24 weeks, to allow the repayment period, if it is a loan, to extend from 2 years to 5 years, and other things to make this just a little bit easier. Knowing that you have a lot of payroll expense, I know you have a lot of capital expense, and there's also some discussion of easing that 75% requirement of money being spent on payroll for you to otherwise be considered to have used the money wisely. What else? I do think we need to support states and communities. My state of Louisiana, it's projected that our state's going to lose 42% of its tax base during this coronavirus. Sales tax revenue going down, hotel bed tax going down. If you're a seasonal state, think Maine. I imagine that this coming season is where Maine gets a lot of their visitors. My next door neighbor used to love to go up to Maine this time of year to go shopping at Land's End, to sit in a hot tub as the weather was a little bit cool, etc. That is off the books. So what do you do for these economies which are seasonal as well? Particularly if the tax base of the city depends upon that influx of visitors. One more example, I was speaking to Donna Shalala, who represents Miami City. Miami City has 90,000 inhabitants, but receives 10 million visitors a year. There's no way that local traffic is going to support all the restaurants and hotels. Without restoration of travel, they have lost the tax revenue they need to support their police, fire, emergency services for the remainder of the year. So I've introduced something yesterday called the SMART Act, which with Bob Menendez, a Republican and a Democrat, in both the House and the Senate, will be introduced, that will make available $500 billion for cities and states to support them through this rough patch. Money they can use to keep their firefighters, their police officers, their emergency medical services, all funded as we go through this next year and a half, where we continue to expect there to be a tremendous negative impact upon our economy. So it's not clear it's going to pass. I think it will. I think it'll eventually be part of a larger bargain, but then I'll return to where we started. You have unique needs. Those needs, please communicate. I will do my best to help. But the degree that Chuck Grassley from Iowa, who's the chair of the Finance Committee, for example, or Mitch McConnell, or Ron Wyden from Oregon, the Democratic ranking member, can also be made aware of your issues is the degree to which those issues will be more appropriately addressed. Let me stop there, Asbel and Richard, but again, thank you for having me. I look forward to your questions.
So thank you, Senator, for your comments today. Appreciate it. And this goes kind of into some of what you were just talking about. So there's 4 business executives and owners that I want to introduce you to that are in some of the key states that you're talking about. And they're going to give you an industry perspective of some of those challenges that you can assist with us that are driven in data, which I know you're a data guy. So I'm going to ask them to they've got about a 30 seconds to 45 seconds here to kind of talk through, and then we have a few questions we want to follow up with you on. So I'm going to turn it to Jim O'Connor, who's in one of our hot spots in New York City, or in New York with Empress EMS. Jim?
Thank you, Asbel. And thank you, Senator, for all you're doing for our country during this pandemic. My name is Jim O'Connor, and I'm with Empress Patient Care EMS, and we've been providing ambulance services to the residents of New Rochelle, New York, which was one of the first hot spots in the United States for COVID-19. In my 40-year EMS career, I've always felt that 9/11 was by far the most challenging time of my career. Well, COVID-19 has forever changed that personal perspective for myself and many other EMS first responders in the metropolitan New York area. As I sit here today speaking with you, our EMTs and paramedics are still dealing with treating and testing COVID patients as they have been since early March. We have not been transporting nearly as many patients to hospitals as we treat low acuity patients in their homes. This has kept patients with mild cases of COVID-19 at home and has had a positive impact on mitigating the spread of the virus, especially in those first few weeks. For the non-COVID-19 low acuity patients, for us to treat in place at home allowed patients and their families to avoid hospitals that were severely overcrowded at the height of the virus's surge in our community. As you may know, our revenue is generated by transporting patients to the hospital. If for whatever reason we don't transport, we will not be paid. It's as simple as that. Please allow me to share some examples of the impact of COVID-19 has had on a company like ours. In a comparative 3-week period, our EMS system in 2019 treated at home and didn't transport 149 patients. In 2020, we treated in place 1,213 patients compared to 149 the year before. Worse than that, in the same 3-week period, cardiac arrests for our EMS crews increased from 64 to 220. EMTs and paramedics were instructed by medical directors to terminate CPR in the field due to overcapacity in our local hospitals. These past days, which turned into weeks, which are now turning into months, have been very challenging for our crews and our company. We have done what has been asked of us without hesitation. I now have to ask you and the federal government for help. Medicare does not pay for treatment by ambulance services providers unless we transport the patient. Pass it on to Dennis Brockway of Maine right now.
Good morning, Senator Cassidy. Thanks for taking time to speak with us today about the issues confronting EMS. My name is Dennis Brockway. I represent Northeast Mobile Health Service and board member of the Maine Ambulance Association. Northeast, one of the largest providers of EMS and wheelchair service in Maine. Since the advent of COVID-19, my company has realized a 25% decline in EMS calls and a reduction of about 60% of our work volume.
I'm going to interject here real quick. Dennis, you must be having some technical issues. If you can, we're all having a problem hearing you. I'm going to jump real quickly to Jim Duke to kind of interject here, and then we will kind of move through and get to these questions really quick for you, Senator. Hard stop at 10.
Thank you, Az. Well, my name's Jim Duke. Welcome, Senator Cassidy and fellow panelists. I operate and am president of ComCare EMS in Kentucky. We operate rural EMS in a much different environment than my friend up in New York. We're a very rural area. We cover 77,000 people in an area of 2,300 square miles. We're primarily in Western Kentucky. We're running into a lot of the same problems, other than we haven't had the surge that we've heard about earlier. We've dealt a lot more with the reduction in volume with our people. We're making about 30% less ambulance runs now than we were making in February and March, or early March. Starting in about mid-March, we saw a significant reduction in our transport volumes. We did not see a reduction, or much of a reduction, in the amount of calls that we were responding to. We were doing a lot more treating in place, just like my friend in New York was talking about. We're transporting less patients. And our business model here with ComCare is we operate with local governments to provide 911 emergency services to communities across Kentucky, and do so in a manner that's cost effective. For that to be cost effective, we have to maximize our opportunity to get reimbursed revenue from our transportations, whether it's from Medicare, Medicaid, private insurances, and so forth. That's down significantly. We're seeing a significant reduction. What we're also seeing is a higher patient acuity in the transportation of the COVID patient from small hospitals, small rural hospitals, to the tertiary care facilities that can care for those patients long term. So when we have a sick COVID patient in a small rural hospital, we're seeing it take as long as 8 hours for our crews to transport that patient to a tertiary care facility and to return home and to get their crews and their trucks decontaminated in a manner where they can make another run safely. That same run might have taken 2 hours or 3 hours in the past, which this in turn means where a lot of businesses right now have downscaled as a result of lower volume, lower ability to generate revenue. We're actually having to maintain or even in some cases increase staffing to make sure we can meet that need. Our association, the Kentucky Ambulance Providers, we represent 120 members across the state of Kentucky. We have reached out to Senator McConnell and his staff to make sure that we are considered for future funding measures and to be included in any funding paths that come moving forward. Thank you for your time. It's been nice to talk to you, and hello from the great Commonwealth of Kentucky. At this time, I'm going to turn it over to my friend Jamie Pafford in Arkansas.
Good morning. Thanks, Jim. Senator, I'm Jamie Pafford, and I am part of a family-owned and operated ambulance service over in Arkansas. My brothers and I service over 70 communities in 5 states in the U.S. Virgin Islands. And as a private provider, our state of Arkansas is covered by about 60% of private providers across the state, as well as many other states around us. And as a healthcare provider, but also a first responder, we respond to federally declared disasters. And of course, COVID has made this emergency, is really highlighted our dual role. But as a private company, we are not eligible to directly submit an application for FEMA public assistance grants. Instead, we need to apply through the state or local government for items not covered by the COVID-19 relief funds that we've received. But our government officials continue to dispute whether a private company is eligible or strapped for resources to help for us to apply right now. Is there a way as we move forward to make sure that we could get FEMA to allow private ambulance companies, much like myself, Acadian, and many, many others on the phone, to apply directly for funds during this COVID-19 crisis? I'm also the chair of the Government Affairs Committee with the American Ambulance Association, and I appreciate you taking the time to listen to us. But most of all, just remember, you're talking to a special bunch of folks. I like to say that us ambulance providers are very special. We're 24/7, 365, regardless of your ability to pay, taking care of business, and we really need you to continue to find ways to funnel money into our ambulance providers' hands, because we have a great shortfall at this time.
Senator, thank you so much. I know you've got about 3 minutes, so I'm going to consolidate 2 questions into one for you so you can opine about it. Number one is the question that Jim O'Connor from New York was talking about of us treating in place low acuity patients. There's not a funding piece. CMS has indicated to us they do not have the statutory authority to waive that. So we'd like for you to kind of to discuss that and the likelihood of us being able to get that into the next stimulus package to allow for ambulance services to treat in place based upon medical protocol and direction, whether through telehealth or under the medical direction. And then to Jamie's point that she just made about direct access to FEMA for private ambulance services who have these private-public partnerships in a lot of these communities to be able to go directly to FEMA for their reimbursement needs. Senator, the floor.
So 3 things. First, 3 things. First, Jim O'Connor could do a great Bernie Sanders imitation. So let me just say that if he wants to be on Saturday Night Live and take that guy's place, I'm sure he could. Secondly, we're in conversation right now with Chuck Grassley, who is the chair of the Finance Committee, as to how do we create the possibility for a treat at home. That just makes total sense to me. And if and Jim's story, mentioning about that, but also what Richard Zuschlag has previously told me, there are some patients you go and evaluate them, and they can stay there, but the economic incentive is the transport. That raises cost of the overall healthcare system. So I'm all with you on that. I think this new paradigm is when we can push that to make that permanent. Secondly, as regards Jamie's question, we will speak to FEMA. We'll try and get clarifying language in the next bill that you can directly go to FEMA and bypass other entities in order to get reimbursed. That kind of acknowledges your unique role. I smiled when I saw that the other Jim is from Kentucky. If you happen to, however degrees of separation you have from Mitch McConnell, just make sure you can collapse those, because if Mitch is on board, that would really be helpful. And back to the New York Jim, getting Schumer on board would also be helpful. Again, that's the majority and minority leader. And if they agree to something, it's going to happen. And so you two have a unique role, but we will also advocate directly with FEMA and for this to be part of the clarifying language.
Well, Senator, I want to say it's the bottom of the, it's the top of the hour actually. So thank you. And I know you have things to do. And so I want to thank you personally for taking the time out of your busy schedule for this as well, and to really speak with our ambulance community today. It will not be forgotten by us. So thank you. Thank you very much for that, Senator.
Absolutely. And by the way, sorry I couldn't hear Dennis, but I do have a Winslow Homer guy sailing off the coast of Maine behind me. So you're with me in a spirit. If not, we couldn't hear your voice. So anyway, thank you all for what you do.
All right. And to all our members, thank you for joining us today and for this town hall. Stay safe and happy EMS week to all of you guys. We appreciate all you do.
Happy EMS week. Yes.
Thank you, guys. Thank you.
you.
Thank you.
Well, you're on mute, Mr. Z.
Are we staying on?
I was just gonna thank Mr. Z. He's on mute right now. And how you doing, Jim? You did really well.
Well,
I think this came off pretty well, and I think this is the future. It was well produced. I'm sorry he gave us only a half hour instead of an hour, but I've come to the conclusion when we can all combine like this and get the senator from New York and Kentucky and Louisiana all on the same page, Arkansas, we do better that way. Collaboration, just one or two senators can't do it, but 4 or 5 of them from different states is the way we get things moving. So hopefully we can do more of these kind of programs to get other senators involved.